For you, all of you who are joining us for the first time, as I mentioned, David is currently a professor at the London School of Hygiene and Tropical Medicine. He's got over 20 years of experience working for the WHO and CDC, and he is also currently the chair of one of the WHO's external advisory groups. So, David, thank you so much again for joining us this evening.
Thanks, Joe.
There's obviously not that many positive news stories out there at the moment in relation to the coronavirus. So what I thought we could do tonight is do a bit of a tour around the world in terms of what's going on and what is those countries' trajectories and where there might be some positive news coming out of there. And then try and think about some of the myths that we can debunk in terms of all the different articles and information that is out there. So maybe let's start with the US. There are different emergency bills being passed. The US has a huge trajectory potentially with the virus. New York is still the epicenter. What can we expect to see in the US over the coming days and weeks?
Well, in the US, as you know, people are traveling freely around the country, and many people are leaving New York to either go to their summer homes somewhere up in the northern part of New York State, or they're going all the way to Florida and other places, as are people on the West Coast. And so when they travel, they will take infection with them if they're infected and set up new foci of transmission in those areas. Europe, on the other hand, has tried to eliminate travel between even member states of the EU in order that they can begin to see a decrease in the surge of patients that's making such heavy demands on the hospitals.
And moving out of the US, we've seen Spain has, again, a huge death rate today. What can we expect to see from Spain?
Well, what we need to understand is the reason that death rates go high. And there are several reasons for that. One is that the people who are elderly, over 60, are more at risk of serious infection. And if they have comorbidities, which everybody knows about, diabetes, lung disease, or hypertension, diseases such as that, they become even more severely ill and many times require a ventilator. So mortality is determined by age, by comorbidities, and by the availability of ventilators in the hospitals that need to treat these patients. And when ventilator supply becomes compromised, when they're all in use or whether there are difficulties in getting them to function properly, there could be increased mortality. I can't say what's happening, what combination of events is happening in Spain that's causing the increase in mortality, but I expect it's all three to some extent.
And just to jump in on that ventilator point that you made, obviously there's lots of news around a lack of supplies of ventilators. So A, why are ventilators so important? I mean, you touched on this briefly, but just to go into a bit more depth. And B, obviously we're seeing lots of countries increase their production of them. What can we expect to see on that, and how can people be supporting that?
Okay, well, first of all, it's a shame that countries didn't take the message from the SARS outbreak back in 2003, because the countries that did, and Asian countries in particular, have no shortage of respirators at present. They stocked up and they did what was right. In other countries, they didn't heed the message as well as they might have, and they didn't stock up with ventilators as they could. What the difficulty and what the need for in ventilators is as follows. People who have an infection with this coronavirus develop difficulties in breathing and difficulties in oxygenating the blood and getting oxygen into the blood. And that occurs, it's called acute respiratory distress, and that occurs very early in some cases, in some infections, and it comes later in others. But it's a major problem in people who have serious illness, the acute respiratory distress. Sometimes that can be relieved just by oxygen flowing into the nasal passages, but other times it requires intubation, a tube into the breathing system, and then hooking onto a ventilator, which automatically makes your lungs inflate and deflate. Those are what are in short supply, the ventilators. And countries with short supplies are seeing higher mortality rates.
And in terms of the UK, just moving over to us right now, obviously the government is mobilising. We have the Excel Centre that's being turned into a temporary hospital. There's a sense of us gearing up for what could be the peak for the coronavirus here in the UK. Can you shed some light on what that could look like and what help will be needed within this time?
You know, I really can't estimate myself what will happen because there are many other factors that play a role in how well the outbreak turns out. Among those are understanding by people in the UK that they can prevent themselves from becoming infected and they can prevent others from becoming infected if they're sick. And so if those messages are able to get through to people, they understand how to protect themselves and protect others, that can have a great impact on the outbreak alone. In addition, there are other things that the government is doing to try to stop transmission. And among them are closing down social gatherings, large gatherings, and other events, and closing public spaces where people can congregate because there they can transmit easily from one to another. So all of these things working together will eventually have an impact on the outbreak, hopefully sooner rather than later. But the jury is still out as to when the peak might arrive. Many modelers have suggested it could arrive in weeks or months, but nobody really knows for sure.
And I mean, just going back to the ventilator question, it was reported today that the UK government has refused to join the EU ventilator scheme because of Brexit, and that instead they will source from within the UK. Do you think the EU scheme has a significant chance of finding supplies earlier than UK manufacturing can?
You know, I can't answer that. This is just a real difficult issue right now because of Brexit and the fact that UK wants to be on its own. And I'm sure the UK will find ways of getting the ventilators as soon as they need them. And we'll try to make sure that, that they don't take them all, that there can be a division between other countries if necessary.
And moving across to Asia, obviously India, one of the the second most populous country in the world, has gone into lockdown. But obviously there's huge problems with that, just in terms of supplies, infrastructure, and actually having enough sort of aid and support for what they're really trying to do there. Can you share some more details on what that could look like and why it's so important for them to still be in lockdown, and I guess how the rest of the world can help support countries like India?
Well, a lockdown is done to decrease transmission, clearly. And it's clear that the Indian government feels that there is sufficient infection already in the country, that there's a risk that there will be widespread transmission. So they've chosen to lock down the country. And hopefully in making that decision, they've also made provisions for how people can get the resources they need to provide food for people, and at the same time that the individual Indian populations understand how they can contribute by protecting others and protecting themselves. So hopefully all this is going on. I think the complete lockdown in India caught the world by surprise. It's not clear how India is implementing this yet, but I think that will become clear in the future. And hopefully they are making provisions for those who work from day to day and feed themselves from hand to mouth.
And I know you might not have the exact answer for this, but I feel it's a question that my friends are asking, my family are asking, and we see come up as a question every single day in doing these briefings. But in your opinion, what are the main reasons why the proportion of deaths and infections are so different across countries? And equally, why we're starting to see now some young people who supposedly before haven't been as susceptible now start becoming ill?
Well, we talked about the factors that increase death among patients, and those include inability to provide the intensive care and ventilation that's required, and also the age of the patients who are being infected and the number of hospital beds. So that's pretty clear, and then the comorbidities. It's pretty clear that in populations in countries where populations are elderly and have comorbidities, there's going to be higher mortality, and that mortality will occur despite ventilators, but ventilators will prevent some of it. At the same time, we're seeing younger people get infected. This is because we're now seeing a wider number of cases, and we're able to really begin to understand the natural history of infection, who's infected and how serious the illness is in each of the people who are infected. We've understood that it's a serious illness for people over 60. We're beginning to understand also that it can be very serious in younger people, and even those as young as 20 or younger.
And in terms of, the UK, going back to us right now, the current lockdown is very much dependent on people voluntarily complying and deciding to themselves to what degree they should self-isolate. Do you think we should be currently under a more stringent lockdown? And if so, why? And what would this look like?
Well, I think what the government is trying to do is they're assessing whether or not people are able to take the messages, internalize those messages, and actually prevent transmission, and especially to the elderly. As you know, the nursing homes are at great risk. And so they're very concentrated on nursing homes and on other places where they could have populations at risk. They've written letters to the people who have comorbidities, recommending that they stay isolated. And the government is trying a bottom-up approach, trying to get the population to participate in the outbreak response. This is not bad. This is a good attempt to do this, and we'll see if they're able to do that the same as have other countries which have had more stringent measures.
And there are certain countries, I'm assuming this is just because there are significantly less cases, but, Europe and the news is very much, focused on sort of Italy, Spain, Germany, to some extent a bit Switzerland. What else is going on across Europe right now?
Well, across Europe, countries are experimenting with different ways of dealing with the outbreak. As most people know, Sweden has decided not to put any rigid or precautionary measures in place, and they're obviously confident that they can deal with patients when they have them, and will have enough hospital beds and ventilators to do that. Other countries are going between what the UK is doing and Sweden is doing, and providing very strict measures, and that includes Germany and others. And others also are doing different ways of approaching the outbreak in general. Some countries are doing a lot of testing to identify people who are infected so they can isolate them. Others are putting more emphasis on other activities, such as mitigation activities, which mean closing down public events and making sure that the population understands the importance of physical distancing, for example. So there's a variety. Sorry, go ahead, Joe.
No, I was going to say, and does that translate across to, let's say, the sort of African continent? We've seen some news of Nigeria, a little bit of Ethiopia. I'm sure there's much more than that, but in terms of what I've seen, but very little apart from sort of South Africa after that. Is that a similar thing to what's happening on the African continent as well?
Yeah, that's right. South Africa is reporting quite a few cases now, and they're looking for them. In the rest of Africa, they're also looking for cases, but it's very difficult to find them when they're mixed in with other infectious diseases, which cause many of the same symptoms. And so it's very difficult for the Africans to really understand yet what might be going on. But I know that the Africa Center for Disease Control in Addis Ababa and the WHO regional office in Brazzaville are working together to make sure that the testing capacity that's required is in countries, and also that they understand how they can best detect when disease first enters, and to determine where it might be spreading within the country. So hopefully these two the relatively new Africa CDC and the World Health Organization working together will have great access to countries and help them be prepared and understand what to do when cases might begin to show up.
And moving on.
Joe, it's important to remember also that Africa has a younger population than most parts of Europe, and younger people do indeed have a less serious illness. We don't know how much less serious, but they do have a less serious illness. So that may be also playing a role in why it's not being detected in African countries, if it is there.
And keeping kind of on the kind of symptom side of things, a question from one of our members. There are many reports of clusters of symptoms that don't fit the kind of classic symptoms of cough and fever. What is your view of these different potential presentations of the disease? So given the lack of widespread testing, should these different kind of symptoms, so sort of diarrhea, I can't even pronounce this word, our member has said, but anosmia, be more widely advertised so that people can have these and take greater precautions to self-isolate? Oh, apparently means the lack of taste or smell. Thank you, Kelly.
Okay, yes. Well, I think most people understand now that there is possibly a lack of smell or taste when there's an infection, and also that there can be things like headaches or muscle aches, severe muscle aches. And these are actually listed on all of the websites that I've seen. But the main two factors that the UK is concentrating on are those that are most surely infection, and those are a fever and a cough, a dry cough that's continuous. So, you know, there are many other symptoms, and I think that a wise message which is being given is if you're sick at all, you should avoid contact with the elderly because you might be carrying the virus and you might infect them. So even if there are minor symptoms that people feel might be COVID infection, they should take precautions. And if they visit the elderly or in any way go near the elderly, they should make sure that they don't touch them or do anything that might cause them to become infected.
The G20 finally met virtually today, and we're obviously discussing funding for vaccines. I think the UK committed a large sum of money to CEPI. What does this sort of mean for the future? Are we seeing other countries equally commit to helping to fund vaccines, both for obviously this coronavirus outbreak, but other subsequent viruses that could be spread in the future?
Well, the UK is one of the most generous international donors, and they have given funding to CEPI, which is coordinating many different vaccine trials. In fact, they're involved in one of the ones that's being begun right now in the US with Moderna, a vaccine company. And they're also working with the World Health Organization and others to determine where there might be gaps in vaccine development and what might need to be done. So any funding that they're given is really welcome by the global community. The big donors in the CEPI are the Bill and Melinda Gates Foundation, the Wellcome Trust, the government of Norway, the government of UK, and several other governments. But the UK has always been rock solid in its provision of support where it's needed on the global health scene.
So let's stay with that glimmer of positivity that we've uncovered. In terms of sort of clinical trials and testing and sort of vaccines and treatments, is there anything positive that's come out over the past couple of days that you would share?
Well, there have been models that can be infected, animal models that can be infected with the virus. I think we might have spoken with that earlier in the week. But there are macaque monkeys that we now know can be infected, as are humans infected, and can become sick. So it's a good place to try new vaccines that are being developed. And these are being very creative. The vaccine developers are very creative in how they're developing their vaccines. They're developing vaccines on top of measles vaccine, for example, or on top of other known vaccines. And they're also using man-made particles that resemble parts of the virus in hopes that they can really now have a vaccine that will be effective. And so there's lots of good news that there's lots of vaccine being developed. The bad news, of course, is that we don't know anything about the immunity that's created by this infection or by vaccines that might be developed. How long it would last? Would a vaccine need to be used in multiple doses? A whole series of questions that still remain. We know, for example, that the minor coronaviruses, those that cause the common cold in humans, don't provide very good immunity, and you can be reinfected from those coronaviruses. We don't know that yet with this coronavirus, and so there's a lot to be learned along with the vaccine research that's going along. On drug trials, there are now many drug trials that are up and running, and some of these are collaborative trials where many different countries are working together to try out things such as chloroquine or other antiviral drugs that have been shown to be effective in the laboratory. These trials will go on and continue to go on, but there's active research, and hopefully there will be a trial that shows a drug which might be effective, or gamma globulin, the antibodies collected from survivors, may also be useful at some point in time.
And just kind of pivoting to the world of the news and the fact that there's just so much information out there and in many cases disinformation. When we think about face masks, obviously if you step into China or Hong Kong right now, you'll see everyone wearing a face mask. Here you don't see anyone with one on. Should we be wearing them? Should we not?
Well, the general view is that masks are useful in preventing people from getting infected if you're coughing or sneezing, because they catch the droplets that you cough or you sneeze. The areas that can be infected by the virus, by droplets from the virus, when someone is coughing or sneezing, include the mouth, the nose, and also the eyes. So if you're wearing a mask to prevent infection, first of all, they've never been shown to be really effective in preventing someone from becoming infected. But at the same time, you would also need to cover your eyes, as is being done in hospitals where there are shields in front of the eyes, so the droplets can't infect the eyes either. So wearing a mask or wearing it part-time or wearing it sometimes and not another is really not a good use of the masks, which are in short supply in the world. The best use is for people who are sick to use them, prevent others from getting infected from the droplets that they put out when they cough or sneeze.
Thank you for that. Are there other things that you're seeing in the news that are just simply wrong and you'd like to debunk?
Well, there's a lot of news out there about what models are showing. And, you know, the infectious disease modelers are very good in what they do. They take the existing evidence that they have or information from other parts of the world that doesn't come from their own country, and they use that in their models to decide what might happen in a worst case scenario and what might happen in a best case scenario. These models are very useful for the public health community because they can then use this information to plan and make contingency planning for potential outbreaks. When the press gets a hold of them and magnifies them and talks about only the worst case scenario, that's really causing concern among people that's unnecessary at this point in time. We don't know the full destiny of this virus. We don't know its actual transmissibility. And so the modelers are taking guesses that they're using based on the evidence that's available today. And they will modify those models as time goes on. But the models today are only providing an estimate. They're not providing what really will happen. And unfortunately, nobody can predict what will happen. We don't know the destiny of this virus as it continues to circulate among human populations. Will it become endemic, like seasonal influenza or like HIV? Or will it eventually disappear, as did the SARS coronavirus? Those are questions no one can answer at present.
And when do you think we might be able to answer them? Is that sort of as we see the virus sort of move through the population as it is doing, and come kind of December, we'll have a bit of a sense? Or is this sort of we wait until spring next year?
Well, I expect already that countries are beginning to do a risk assessment and to see whether the measures that they put in place have been effective and accomplished the goal that they've been put in place to achieve. So they'll be looking to see if they have decreased patients in hospitals, a few things like that. And that probably will happen in the next 2 or 3 weeks. And then after that, there will be a reassessment of what they're doing to see whether they want to continue or not. And all that will depend a lot on what they find has been going on in the communities. And that we don't know yet because we don't have that validated test to determine antibody, specific antibody to this coronavirus in populations. Once that test is available, and it will be available within 2 or 3 weeks, then we can begin to understand what's gone on in the communities in the past, how many people have been infected and were asymptomatic or not even recognized, and it'll give a good idea of what needs to be done in the future. So in 3 or 4 weeks, we'll have a better idea, at least of what's going on in communities where the virus might have been spreading.
Thank you so much, David, and thank you so much for joining us this evening. Just before we kind of kicked off with Dave and I were talking about how do you sort of live in these uncertain times and stay positive. So I'm going to force David to give you the answer that he gave. He told me very wisely at the beginning of our kind of briefing call for this. So David, what is your advice for living through this period?
Well, you know, we're living in a very difficult period. If we understand how we can protect ourselves and protect others, we should get on with looking at other things as well and trying to figure out some of the great problems in the world. We have the opportunity, many of us are in front of computer screens because we're not allowed to travel or don't want to travel, we're self-isolating. This is a good time to get discussions going about other issues as well, the social inequalities in the world, for example. We need to really be looking at all these problems together and not just focus our lives on this particular pandemic, because this pandemic may be with us for a longer period of time, or it may regulate itself within a few months when people begin to go out more into the open air. So we need to just concentrate on this outbreak, but also on other things that are important in the world. And we now have the time to do that.
Brilliant. Thank you so much, David, again for joining us. Thank you, all Conjure members who have joined and shared your questions. And we look forward to seeing you on tomorrow's briefing. Have a good evening, and we'll see you soon. Thank you again.
Thanks very much, Joe.
Bye.